Hello, running friends. It is day 2 of our Running for Success group, and earlier today I asked you guys a question. That question was to list 2 out of the 5 top or most common running injuries that runners experience. So I have listed below or above in this post here the 5 most common type of running injuries. Number 1 is patellofemoral pain syndrome. A lot of people might refer to this as runner's knee, anterior knee pain, meaning the front of the knee pain. It's usually very global. You cannot pinpoint one specific area. It's something that comes on and gradually builds as you are completing your run for that day. Severity might vary from person to person, and it may not even stop somebody from completely running. It may cause enough pain though for several hours after, up to 24, 48 hours after a run. So what is behind or causing this front knee pain? A lot of times it's not one specific reason. Especially it occurs in people that may not have had a fall or specific mechanism that caused the pain. What the underlying issue usually involves is what I consider muscle imbalances. This includes lack of flexibility in certain muscles or joints. It could also be caused from strength deficits in certain muscles. A lot of times the core and the hip muscles are key in runners, and they're all often neglected. It can occur from muscle imbalances between the quadriceps and the hamstrings, which is the front and back side of your thigh muscles. As a runner, we, during our running gait pattern, are always running on one leg. We don't run with both feet in contact. But yet, a lot of us, don't exercise, meaning strengthen at all. We kind of neglect that. Or we might work on strengthening. However, we may not do maybe the most functional or appropriate strengthening exercises, and that's something that's going to be covered in a couple days. I will go through some running recommendation exercises for you guys. The number 2 injury is iliotibial band syndrome, ITB syndrome. This occurs on the outside of your leg, and the ITB, the band, is actually not a muscle. It's just tissue that runs from the outside of your hip down to the outside part of your knee. And a lot of runners have problems with this. And you might have tried yourself or know people that have used a foam roller, different trigger point treatments, a rolling pin type thing to help massage over that area. And because the pressure that you feel with that, a lot of people can have symptom relief or feel like their IT band is stretching out. How I describe it is, it's like taking Advil. You take something to mask the pain, you stub your toe, you go to rub it, and that can help distract some of that pain, therefore you don't feel it. So I'm not saying foam rollers and trigger point and things like that can't help, but they don't fix the underlying issue. A lot of times there are those strength deficits and neuromuscular control issues up in the glute muscles, up in the hips, the outside. So addressing those are going to be key, and that is something that we'll address as well in the exercise section in a couple days. A third common injury is plantar fasciitis, and I know a few of you guys, I'm sure in the group, have experienced it or currently experiencing it. This is one diagnosis I would encourage you guys to seek treatment immediately, especially a physical therapist. The reason for plantar fasciitis varies from person to person. Some people, it might be commonly associated with flat feet or pronation. And that is thought because that collapses and weakens that plantar fascia in the bottom of your foot, and a lot of the real deep, small foot muscles become weak. I've also seen where people just naturally have less of a fat pad on your heel bone, and because there's not a lot of cushion there for whatever reason, that can also expose the plantar fascia. A lot of times the pain is not exactly on the bottom of the foot, but on the inside back part of the heel, and that's where the plantar fascia actually attaches to the bone. And so as a physical therapist, that's where I start with some of my hands-on manual techniques, is addressing from that origin spot down to the bottom of the foot where the plantar fascia really is. Some key treatments: physical therapists need to help mobilize some of the joints in your ankle. Your talocrural joint is your big ankle that allows it to move up and down, in and out. And then there's also a joint called your subtalar joint, which is your heel bone attaching up towards the ankle area in the midfoot. So that is a joint that doesn't have a lot of movement but can also be stiff. And mobilizing those joints can help change the plantar fascia in the sense of improving some mobility and stiffness there. Calf stretching, soleus stretching is also going to be key and important. So those are things that I will show you guys in a later video. Injections can be common and can be beneficial, but I've had a lot of patients over 6 to 8 weeks that I can help treat, alleviate, and get back to running with just hands-on manual techniques, showing certain foot muscle exercises and calf stretching. Again, those will be referenced later on. Tibial stress fractures are also very common, and that's your shin bone. These can occur from training errors, like we talked about yesterday, increasing your mileage over a very short period of time. It also has to deal with your running mechanics and how your foot contacts the ground. That's something we'll also talk about in another video, on the foot placement when you contact the ground and how that can be tweaked to prevent. And I've also had some people that have had stress fractures that when they are healed, that gait mechanics is the first thing we address. And then the fifth is going to be knee meniscal injuries. Your meniscus is, think of a sponge, a shock absorbency cushion in between your thigh bone, your femur, and your tibia, your lower leg bone. And it's exactly that, shock absorbency. Again, it could relate a little bit to your running mechanics and how your foot contacts. If you contact more with your heel, you're going to send increased stress up your leg, up to the knee, the hip, and even the low back. So a lot of these injuries are not one specific incident or fall, but just underlying issues, whether some of them could be just the structure of your joints and rotation in the hip or even of your lower leg, which you start running over time, eventually that could potentially set you up for an injury. So those are the top 5. I will announce the winner. Again, I'm sure several of you have guessed at least 2. I'm just going to go with the first person that answered right away. Again, I will post questions first thing in the morning, so check in early so that way you guys can have your guests out there first. Thank you very much, and please post any comments, questions below. Okay? Thanks, guys.